to learn code with Ganny, a place where we make code easy and simple like ABC. Today we are going to talk about how we can secure, assuming we are the first person that reach a place of accident. What are the process that we are going to take? We know the code is PAR, which is protect, alert, and secure the LEO, that is the place of accident, before any intervention or any emergency service will come. What are the things that we are going to do? Then let's go to the class. But in case you are getting it, you are getting value in this all my video, do not forget to like, share, and subscribe to this channel. And moreover, also you can also put your question in the comment section. So let's go to the class. In the event of road accident, there are two possibilities. If the emergency service are intervening, there's no need to stop, and after slowing down you must continue your journey so as not to create a traffic jam. But if the emergency service are not yet on the site and the accident has just occurred, it is compulsory to stop and help the victim. Not to trigger the alert or not to stop is punishable by sanction for not assisting anyone in danger. A part. What are the things to do generally? A. Protect yourself and warn other drivers. A witness to an accident, you must slow down, turn on your hazard light to signal other vehicle in the presence of the danger nearby. Then you must stop by taking precautions so as not to trigger the risk of collision or an accident. Finally, we must not block the arrival of the emergency security service. Before leaving your vehicle, you must put on your yellow vest, and also it is necessary to place the safety triangle in a way that is close to the accident on each side of the accident, at least the distance of 30 meters. If the accident happened very close to a turn, that is a curve, then the triangle must be placed before the turn, before the curve, that is before the virage, which is the curve. Attention, if the accident happened on the highway, on the auto route, or in the express, please do not put a safety triangle there because of the wind. You know, there is windy there. All the vehicles are very fast. They can take away the triangle and can cause another accident again. Then what to do? The B part is get safety. All the driver present at the scene of the accident who will not participate in the emergency service must leave their vehicle and take refuge at the top of the road. Then if it is an accident, they have to move to the side of the highway. The C part is talking about the first junction. What are you supposed to do if this vehicle have not come? The people that wants to help, the first aid service have not come, but what are you going to do? It is necessary to assess the risk associated with the accident. That is the cause of the accident. Is it fuel leakage? Is it the nature of the load? Maybe the driver is carrying too much load. Is it a flammable liquid? Is it a dangerous material or the environment? If possible, it is essential to tighten the handbrake of the damaged vehicle. To eliminate the risk of fire, where possible, turn off the contact of the damaged vehicle or disconnect the battery. Surveillance of the danger zone should be ensured to prevent people from entering it. If there is a start of fire already, and if you have a fire extinguisher, you must direct the jet towards the base of the flame, or you use a sand or blanket. Please take note, do not use water. If there are several witnesses, the action should be divided for effective action. Security. After securing the scene, the surrounding of the accident, the emergency service must be alerted. How? 1. By call. The alert must be quick and accurate. It must be given using a phone mobile or a land phone or a call terminal. By phone, what are you going to dial? By dialing 18 for firefighter or 112 with a mobile phone. That is European emergency call number. 17 for police. 15 for SAMU, which is an ambulance, from mobile phone. Even if it is locked or borrowed from a third party, it is always possible to call emergency service. Okay, it is always easy. By call terminal, this is a call terminal here. You can see this is a call terminal. By call terminal, it automatically indicates the position to emergency service. With e-call button, which we can find in the car, like this, SOS. The European Automatic Emergency Call System is a device that allowed a damaged car to instantly call emergency service while sending its precise position, whether the driver are aware or not, and regardless of the country in European where the vehicle is located. Then B, information. The information to be provided must be precise and complete. They allow the emergency service to adapt their intervention device. 1. Location of the accident as precise as possible. Street name, road or highway name. The nature of the accident, whether it's fire, is it a shock, how many number of vehicles are involved. The number of victims and their condition. Is it a loss of blood? Is it a loss of consciousness? Is it an injury or something has happened? The accident has been serious. This one is just a tip. When contacting an emergency service in the event of accident, please do not hang up until the operator asks you to do so, because there might be more information they want to ask you that you did not give them. So we are talking about how you are going to carry out your first gesture. How are you going to carry it out? That is what we are talking about. People on the scene must take care of the injured. That is the people that had an accident, to avoid injection that could worsen the state of their health. What to do? Firstly, evaluate injuries. While waiting for the arrival of emergency service and without medical knowledge, however, we must try to assess the condition of the injured person, like their breathing, their loss of consciousness, whether there is a fracture or there is bleeding. As a general rule, it is recommended to cover the injured person. If possible, use a survivor blanket in case you have it. Number 2, if a victim is bleeding, a bleeding that stops quickly is not a hemorrhage. Hemorrhage is detected when the blood is prolonged and abundant. This can endanger the victim's life. We must therefore act by compressing the bleeding place with our hand, or with our finger to protect it, so that we can be able to avoid the risk of infection. If it is possible, the victim is conscious, that is, the victim is alive, ask him to compress the wound directly by his own hand, so that he can be able to allow him to stay alive. The C part is if the victim has a trauma lesion. What is that? These are the bone damage, whether the leg has broken, it has fracture, spinal cord dislocation, or any part of the body such as chest, back, lower limb, abdomen is seriously affected. The symptoms that measure the extent of this trauma are diverse. 1, maybe impossibility to move, or there is serious pain or swelling of the affected part, or deformation, or headache, or vomiting. It is recommended not to move the victim, especially if the pain is on the back or neck, which may be the sign of a spinal cord is affected. So we go to the number 4, which is the D part. If the victim loses or has lost consciousness, this position facilitates the respiratory tract or flow of liquid, to present in the throat. You have to, that is this position, you have to put him in this position, if he have lost his consciousness. To assess the victim's state of consciousness, it is necessary to ask him a simple question: what is your name? What day are we? And ask him to execute some simple order. Move your hand, your leg, posture, and do that. Okay, to control his breath, you must lay the victim on his back and lift his head, listen and check his breath every 10 seconds. When the victim does not respond to solicitation but breathing, she must be in place of PLS. This is PLS position. PLS. This is the position of PLS. If the victim has a cardiac arrest, it increases the chance of survival of a victim by 10% if it's practiced quickly. An emergency operator will be able to tell you the procedure to carry out if the emergency service are not yet present at the accident site. During cardiac arrest, brain damage due to lack of oxygen occur from the first minute. A person in cardiac arrest no longer breathes in a disorderly way and does not react. It is necessary to alert the emergency service very quickly. If possible, practice CPR if the person is trained in this gesture, or use a defibrillator. An advice tip: in the case of accident, please do not give the victim water. You have to remove, if it is a bike accident, remove his helmet, and then you do not have the right to move the injured person. You do not have the right to move the injured person or except in one condition: in the risk of explosion or fire. And if in that case you move in, you have to place that person in PLS, which is in this position. Thank you. Till I see you in my next class. I hope I'm making sense. If I'm making sense, please do not forget to like, share and subscribe to my channel. Thank you.